Can I start with an update on the Prime Minister? He's still in intensive care, but he continues to make positive step forwards and he's in good spirits. As we look forward to the long bank holiday Easter weekend, I know some people are going to start wondering, is it time to ease up on the rules? So I have to say thank you for your sacrifice, but also we're not done yet. We must keep going. Let me just explain a little bit about why that's so important. Today I chaired a COBRA meeting with senior ministers, officials and representatives from Scotland, Wales, Northern Ireland, as well as the Mayor of London, so that we could take stock and assess where we are right across the United Kingdom. And at this stage, the government is continuing to gather all of the relevant data to obtain the fullest picture possible of the effects of the social distancing measures that we've put in place. Now, while the early signs suggest that they are having the impact that we need to see, it's too early to say that conclusively. SAGE will meet next week to discuss the latest evidence and will keep the measures we've put in place under review. As we've said on many occasions now, we'll be guided by the science at all times. These restrictions take their toll day in, day out on people's livelihoods, on people's quality of life, on people's mental health. And I appreciate that it's often the little things that hurt the most. With the Easter bank holiday coming up, I'd normally spend it with my two boys, 7 and 5 years old, with their grandparents doing an Easter egg hunt. And I know there's going to be lots of people who would normally be planning a family get-together or just getting out in the sunshine with friends and loved ones. Unfortunately, right now, we just can't do those sorts of things. And I'm really sorry about that. But just take a moment to think of the progress that we've already made. Following the guidance, staying at home, denying the virus what it needs to spread more easily and to kill more people. It's been almost 3 weeks and we're starting to see the impact of the sacrifices we've all made. But the deaths are still rising and we haven't yet reached the peak of the virus. So it's still too early to lift the measures that we've put in place. We must stick to the plan and we must continue to be guided by the science.
The time when I was first talking about this, the doubling time, how fast we were doubling in terms of numbers, particularly in intensive care, was around about 3 days. It varied a bit. This has got steadily longer in time over the last 2 weeks, thanks to what people have done. And as Sir Patrick showed in the data, this is really now becoming not quite flat, but doubling time is now 6 or more days in almost everywhere in the country and extending in time. That has only happened because of what everybody has done, what we've all done in terms of staying at home and only going out for work, exercise and critical shopping and medical care.
In the community, at the moment, you would expect there to be no doubling time. This is not doubling. In the community, you would expect this now to be shrinking for all the reasons I've said, and the evidence suggests that that's what's happening in terms of the transmission in community. So that's all points in the right direction, and the doubling time in ICU is a reflection of what's happening earlier and the efforts that have been made in terms of social distancing.